And welcome to the sixth meeting of the Community Review Board for the OHSU Legacy Transaction Review. I'm Rhonda Zaycox with Insight for Action, and I'm facilitating these meetings, and people are being let in right now. But let's move to the next slide. Thank you. Just a quick reminder about meeting logistics. The meeting is being recorded. Closed captioning is available. And for Community Review Board members, just a reminder that if you want to make a comment or ask a question, just click the react button and select raise hand. And you can also always physically raise your hand. And thank you for remain unmuted until it's your time to speak. Next slide, please. Just a reminder for the members of the public who are joining us today, anyone can submit a public comment about the proposed transaction by emailing, submitting a comment via a public comment form, or leaving a voicemail. And all of these forms of communication will be uploaded into the chat for your reference. Next slide, please. A quick reminder about the chat feature. Only the host and co-host can see chat messages. Again, Community Review Board members, if you are experiencing any technical difficulties, please send a chat message to Lauren Neely. Members of the public, you can send any comments or questions for the Community Review Board to the email, public comment form, or voicemail that we just shared that will be in the chat. Next slide, please. Our goal today is continuing to discuss concerns and opportunities of the proposed transaction and begin working towards a recommendation to Oregon Health Authority. We will, after a quick round of brief introductions, recap what we heard the Community Review Board share last week about concerns and opportunities, as well as specific observations around the first two criteria of the healthcare market oversight recommendation framework. We will then continue discussing the latter three criteria recommendation. And if time allows, we'll start sharing the process for discussing the recommendation. We will take a 5-minute break about halfway through the meeting. I'm acknowledging this is an hour-and-a-half meeting. Our previous meetings have been 2 hours. So I'll keep my eye on the clock, and about halfway through, we'll take a 5-minute break. Okay. Next slide, please. I would invite each of the Community Review Board members, if you haven't already done so, to put your camera on for the moment and to go around and share your name and just remind us if you're representing yourself or an organization on the Community Review Board. And I'll call out names. Howard, would you like to start?
Yes, I'm Howard Cohen. I'm a retired physician living in Oregon City. I'm just representing myself.
Thank you, Howard. Appreciate that. Jerry?
Jerry Dalnes, living in West Lynn, representing myself.
Thank you, Jerry. Joanna, are you with us? Yes, there, I see you.
Yes. Hi, good morning. Joanna Mott. I'm a retired higher education administrator, and I'm representing myself, and I live in Klamath Falls.
Thank you, Joanna. Joe.
Good morning, everybody. I am Joe Schnabel. I'm a retired hospital pharmacist representing myself, and I live in Portland.
Thank you, Joe. Latoria, are you with us? Okay. We'll come back to Latoria when she joins us. Leslie. Oh, Leslie, I'm having a hard time hearing you. I don't know if other people are experiencing that as well.
Teresa, you can hear me, or are you having trouble?
I can hear that you're talking, but it's extremely faint. Lauren, can you verify if you're hearing that similar?
Yeah, it's just pretty quiet, I guess, is the only issue.
I don't know if you can increase your volume.
I am having trouble. I'm Leslie Foreign.
Oh,
I'll work.
that's better.
Yeah, we'll work on it when we have a break. Leslie Foreign, representing a community perspective myself, and live in Portland.
Thank you, Leslie. Appreciate it. Teresa.
Hello, I'm Teresa Goodell, a retired registered nurse, and I only represent myself.
Thank you, Teresa. And Wendy, are you with us? Okay. We'll come back with Wendy and Latoria when they join us. Thank you very much. Next slide, please. Again, we've looked at these agreements at the beginning of every meeting that we've had since we agreed to them on the first meeting. And again, I just am so appreciative how well we are all following the agreements. I just want to highlight agreement number 5 today. Welcome disagreement, varied opposing ideas, of course, without being disagreeable. And so I just encourage us to share our varied perspectives, because this is how we're going to learn from each other and come up with the best recommendation. So just encouraging us to continue sharing our diverse perspectives on this transaction. Next one, please. Next slide. Our proposed timeline has changed slightly since we went over this last week. Of course, last week we debriefed the public hearing and began discussing the opportunities and concerns about the proposed transaction and talked specifically about 2 criteria with the healthcare market oversight recommendation framework. Today, we are going to look back on what we shared and see if we got it right in terms of your overall opportunities and concerns, as well as your observations about the first 2 of the 5 criteria. And then we'll move forward on sharing concerns and opportunities for the remaining 3 criteria of the healthcare market oversight recommendation framework. We are hoping next Monday on March 31st that you can then, look back on the highlights that we gathered across those 5 criteria and to finalize and make the recommendation. Then we'll take a week off. We will not have the April 7th meeting. I believe Lauren has already canceled that, because in the meantime, Oregon Health Authority staff will be drafting a recommendation memo based on what your recommendation is. And so we will come back on April 16th, where the Community Review Board member will review that draft and make modifications and, if ready, to approve that. It appears that the April 16th meeting may be scheduled just to ensure that we have maximum participation from the CRB members. Okay, next slide, please. All right, let's recap the discussion that we heard last week to ensure that we at Oregon Health Authority Oregon Health Authority and myself are capturing your observations, perspectives correctly. Next slide, please. Okay. Again, last week, we had the opportunity to share just our general observations around opportunities and concerns. And these are the general opportunities that we heard the Community Review Board members shared about the transaction in general. I'm going to read the bullets and then ask how well did we capture, your stated opinions, and what else may need to be included. So what we heard from you was both entities are committed and have a good intent for the proposed transaction. We also heard from the Community Review Board members that the possibility of the creation of the Health Equity Foundation with around $600 million could have a huge impact for the state of Oregon, specifically around health equity and potentially access for medically underserved areas. We noted that from especially the public comments that there's many nonprofits and professional organizations that are in support of this transaction. The members also talked about, wow, this would allow the freeing up of OHSU capacity to provide specialty care and really decrease wait times to access that care. There was some, talked a little bit about an opportunity as well. What happens to Cox and access if transaction does not occur? So those were some of the themes that we heard from opportunities. what I'm going to do is invite folks to raise their hand, and I'll just call you on order. How well do we capture these observations that we heard last week? Provide any feedback on that. Or second, what's missing? What else needs to be included? So please feel free to raise your hand and I'll just call you in order. Yeah, Howard, please.
Generally, I think it looks okay. I think I would make a couple comments about the opportunities. One is the amount of money in the Health Equity Foundation piece of it has been stated to be $6 million, but that I think there's a little bit of unclarity about whether that's actually going to be the actual amount. And I would just change the fourth bullet to say decrease wait times to access tertiary care.
Thank you, Howard, for kicking us off. And what I heard you say is just you're unclear about the exact amount of money for the Health Equity Foundation. And in the fourth bullet, we want to make sure we're about decreasing tertiary care.
Right.
Great. Thank you, Howard. Any other feedback, comments? Howard did a great job of kicking us off. Okay, Joe, please. And Leslie.
So on the fourth bullet that Howard just made a comment on, I think primary care was also one of the goals to reduce wait times for primary care as well. So you might need to kind of include both of those things.
Thank you, Joe, for that clarification. Leslie.
That was my same thing about primary care for that bullet. I also am curious, do we need to build out bullet number 3, or maybe it's not critical that it's built out. Many nonprofits and professional organizations are in support. I don't know if that's as strong as it could be, if we could, and I'm happy to give it some thought to see if we need to dig into that a little bit deeper, like what does that mean? And then the other comment or curiosity I had was the 5th bullet, 1, 2, 3, 4. What happens to cost and access of transaction does not occur. I felt like that one should be on the next slide. I didn't feel like that was an opportunity bullet point there.
Thank you, Leslie. And Leslie, I just want to go back to when you were discussing the 3rd bullet. You thought, we maybe need to dig into what that support is like. Is there anything that you wanted to offer for changes on this slide right now around that one? Oh, I'm sorry, Leslie. Yeah, if you can go closer. Yeah, thank you to your mic.
Give it a minute because it's kind of like, so what to me? Like, many nonprofits, like, what does that mean? They're in support of the transaction? Are they in support of increasing the access? Like, in support of what? It just felt a little bit like unfinished to me. So let me think on it for just a hot minute and see if I can put something in the chat or come back off mute.
Thank you, Leslie. Appreciate that. Okay, Joanna.
So I agree with the bullets. I think I agree with adding tertiary care onto that 4th bullet, and I agree that that 5th bullet does not seem to belong in opportunities. It's more risk of, if it doesn't happen, what are the consequences rather than an opportunity.
Thank you, Joanna. Wendy? Oh, hey, Wendy. Good to see you. Wendy, before you share, will you just briefly say hello, and just perhaps you can remind us where you're from and if you're representing yourself and or an organization.
Yeah, Wendy Martin, Portland, and I am representing myself, not an organization.
Thank you.
I think everything on here is accurate. I do agree with the comments on the 3rd and 4th bullets and our ability to expand on those. Not saying what's up there isn't accurate, but I think the concerns were deeper and larger than just that. And then I was going to recommend that the fifth bullet point be sort of reworded as an opportunity to prevent potential reduction of services in especially rural areas for some of those more specialty care items. I know there've been I can't think off the top of my head right now, but a couple of things in the news over the last year where some services were being restricted. If there's an opportunity to prevent that from continuing to happen, it is truly an opportunity.
So, Wendy, thank you so much. So what I heard your proposal for the fifth bullet was to rephrase that more something around it's an opportunity perhaps for preventing reduction of services in specialty care in underserved areas. Is that what you're proposing? Okay, I'm going to come back to, go ahead, Wendy.
And maybe it's care in general, not just specialty care. Specialty care is what is really top of mind for me based on recent events, but I believe it would apply to all care.
Okay, I'm going to come back to the group just to see if people are okay with that proposal to change, since we had some proposals to eliminate it. All right, Howard?
I just want to revisit the fourth bullet again. I know people want to add primary care as a to that, but to me, the primary care piece is a lot more questionable. Whether that's actually, maybe it's an opportunity, but it seems softer than the tertiary care access.
Got it. So I am hearing some members saying that both, and I'm hearing you're saying a little bit softer, so we could potentially work on the wording with that. Thank you. Teresa?
I'm a little bit unclear and wondering if perhaps others are as well about how we're thinking about opportunities. Are these things that are potential outcomes? Is this what the application told us might happen? Or the goals and aims of the transaction? Or are these things that we realistically believe will occur?
Teresa, that is a great question. I'm going to pause for a moment. I think when we asked it, it was, what are you seeing are opportunities? And most likely you're going to have different interpretations, but I think it is in the broadest sense. What do you think potentially can happen? And that's an opportunity. And some of those may be more plausible than others, but I don't think we're splitting hairs just to what we actually have evidence to say that will happen. But I'm going to step back and see if anyone from Oregon Health Authority or another member wants to interpret or answer Teresa's question. Okay, so Teresa, you okay with that? We're really just having it at the broadest sense of what our community members seeing as opportunities. Some may be much more evidence informed and some less. Wendy. All right, you just need to turn your hand down. Okay, same with you, Howard. Are you done, or did you want to ask something else?
I would just second what Teresa said. I think the first and third bullet I wouldn't call them opportunities. I think they're things we agree are true.
Okay. Thank you, Howard. All right, Joanne, and then we'll move on. I just want to test the fifth bullet, and then we'll move on. Yes, Joanna?
I agree with wording that fifth bullet and then including it in there as an opportunity to prevent reduction in access and increasing costs. I know there was a couple of public comments that talked about things that Legacy has already started and would continue in terms of closing things down and stopping services. So I think that works well to reword it. And I'm okay. I kind of feel like the bullet number 4, I guess I sort of am on the end with Howard and saying it's to access tertiary care. If we're talking about OHSU, then that's sort of the side of it that we're looking at, the way the bullet is written right now.
All right, thank you, Joanna. So we're going to make some modifications to bullet 4, really highlighting tertiary care and perhaps perhaps primary care, but ensuring that tertiary care is included in that. And then for the fifth, we've heard some proposals to keep it in here and to change it more to prevent reduction of access and services and care, specifically in underserved areas. Is there anybody who's concerned about making that revision? Okay. All right, let's move on to the next slide, please. All right. Here was what we heard, we meaning myself and Oregon Health Authority, of concerns about the transaction in general. And they were related into several areas. First was around metrics. There was concerns about what happens if OHSU can't meet the metrics kind of post-transaction. Some of you had concerns that metrics were not fully developed in the sense that there was really not a lot of details about how many of those metrics will be implemented. In terms of Legacy's plans, during the public hearing, some mentioned that they shared steps that they could already be taken. And so just kind of concerned, why weren't those things happening now? There were concerns shared about union and non-union workforce not being treated the same. Unsure why and how that was happening. There was concerns just about the changing financial conditions in both entities since the transaction was proposed and how that might be impacting the entities or this transaction. There was some concerns about changes in access to care and specifically for in-network status members who have in-network status, how that might change people's access to care. There was some concerns that commercial insurance prices may increase, may impact premiums. There was also a concern about the impact for Medicaid patients, since Medicaid reimbursed typically at a lower rate than commercial prices, and knowing that Legacy historically has provided a lot of Medicaid care services to Medicaid patients. There was some concerns around a single gatekeeper. Right now, we have OHSU and Legacy that each has their own gatekeeping for scheduling and being able to access specialty care. And there was concern if that became just one gatekeeping component of this very large entity, how would that affect access to care, especially for specialty care? There was also some concern about the potential of that Community Health Equity Foundation being formed and the way in which community members would be able to inform and influence the community foundation strategies and approaches. There was also just some concerns that nothing maybe really get better even after this transaction happens. So those were the concerns that we heard. So again, I'm curious about how well did we capture your concerns or what else needs to be included? And we'll kind of do the same thing if people can raise their hands. Thank you, Teresa.
With respect to the single gatekeeper for specialty care, a lot of the specialty care that's offered at both OHSU and Legacy is also offered by Providence facilities. So I don't know if we'd have a single, but it certainly would give OHSU a huge market share over specialty care. And the other thing, the last point, worried nothing will get better. Yes, but I'm also worried things will get worse because of what the literature shows about increased prices, and increased pricing reduces access. That deeply concerns me.
Okay, so what I heard you say is for the bullet around single gatekeeper, noting that there are other healthcare providers and that so they wouldn't be the only gatekeeper on that. And the in terms of the last bullet point is you're concerned things may get worse as well. Okay. Thank you, Teresa.
Maybe we should say single gatekeeper for tertiary and quaternary care.
For tertiary.
Although OHSU is kind of that already.
Okay. All right. Howard, please. Oh, Howard, you're on mute if you're sharing your observations.
The metrics, I think, are, in my mind, there's a long timeline. It's not just that they're not fully developed. I think there's a long timeline for developing them. They're
For
given,
developing the metrics and implementing, and then implementing.
they have metrics listed, but they have like an 18-month timeline, which I think is longer than it needs to be. That's one thing I would say. I agree strongly with that union, non-union um, not being treated the same that I think Joe brought up, which was on my list also last time. I think the commercial prices, um, I think we should make it a little clearer that it's the merger or the acquisition that may increase prices more than it otherwise would increase without it. And because I think their commercial prices are increasing anyway, but my view is I think this will have an impact on the amount of increase. And I think I agree with the single gatekeeper piece. I would just say Legacy also provides tertiary and quaternary care now. It isn't just OHSU. So that's a change, I think, in terms of referrals into either, it could be to either place. And there are other, I think just to be clear, there are other tertiary quaternary providers in the community besides what will be this single OHSU one. Providence certainly does provide some of that same kind of care, for example.
Okay, thanks, Howard. So I hear you gave feedback on the metrics. It's just more of a really long time period for developing the metrics, up to 18 months. And as far as commercial prices, prices are always going up, but the acquisition may actually increase them otherwise without it. And the single gatekeeper, again, just noting that there is others beyond OHSU. Great. Leslie, please.
Thanks, Rhonda. I just want a clarification on that single gatekeeper, so I'm understanding that. Is that also could be said is that this could create a monopoly and that the patient experience isn't the same, just so I'm clear on what that term means.
Great. I would appreciate it if a community review board member would share their perspective around that with Leslie.
I believe this came out of a question or a concern that I voiced in the last meeting, where I've heard a lot of reports, more reports over the last year and a half than prior to that, of referrals even from an outside of the OHSU system, specifically into the OHSU system, for pretty high level services and referrals being refused because the practitioners couldn't take on additional patients. So that's really where that concern originated. And in my mind, at least, where those gatekeepers are coming up in conversations I'm having with employees who are and friends and family members, and even myself, who are attempting to access new services.
Thank you so much, Wendy, for sharing that. Leslie, did that give you more clarity?
Yeah, I think so. Thank you, Wendy. I think it's really the concern is that reducing options and limiting what patients or Oregonians choice they might have with this concern here with this acquisition. So I just want to be clear, that is a concern. And if that's encapsulated in the gatekeeping bullet point, I'm fine with that, but just want to note that. The other concern I'm curious about is, and I know we've talked a little bit about this and it's not been a part of our conversations, but it was a huge component at the public hearing and is a very large component seen in the written comments, is the primate center.
Mm-hmm.
I just don't know what our role is in that, but that is a concern of clearly what the public is concerned about, that OHSU can't do the work at their primate center. So how could they take care of patients and Legacy. So I just want to note that. And then the other concern that isn't noted here, and maybe it's included in another bullet point or implied, is that whole issue of the Southwest Washington, and I believe it was Unity Behavioral Health that was not included in this transaction. So what does that mean for those living in Southwest Washington accessing Legacy services?
All right, thank you, Leslie. So what I heard you is that really the gatekeeper function may just really dampen options for patients. And two ones that you think are important that aren't on this list is the concerns about the primate center that was shared through the public hearing and comments, and just what does this transaction mean for people living in Southwest Washington, knowing that this HICMO is only focused on Oregon. Thank you. All right, Teresa?
With respect to the primate center, OHSU is required to regularly report the health and any injuries or illnesses or deaths of animals. And they do get periodic visits from outside observers, government, and funders, et cetera. So I went to the website and found that as recently as October of last year, a monkey died because it had symptoms of sepsis that were not attended to. And that concerns me a lot. I think that's given the fines that they've had in the past and all the bad publicity, it strikes me as very odd that that's still going on. It tells me something is wrong in how much value is placed on the well-being of the animals. But again, I'm like Leslie said, I'm not 100% sure that we can tell OHSU which programs it has to close. I don't feel like I have that authority or enough knowledge to prescribe that. One more comment about the single gatekeeper bullet point. Providence does not have a children's hospital and they're not a trauma center. And those are key specialty areas that both OHSU and Legacy provide to the community. Each of them has that. So that will be fully consolidated. And those are two service lines in hospitals typically that serve a greater proportion of Medicaid patients. So there is a concern in my mind about access to those services should this transaction go through.
Thank you, Teresa. So again, what I heard you say is your concern about the primate center, but still unsure what the role is of the committee in that. And I also heard you talk about the single gatekeeper that Providence and other health systems don't have the trauma center children's hospital. So concerned about the access to that. Okay, Wendy, please.
I was wondering if rephrasing the gatekeeper, I think there's been enough conversation and clarification even within this group that it might be confusing. So is it easier for us to rephrase this or better for us to rephrase this around denied referrals or lack of access, lack of accepting new patients, which is access, but I guess access can come in a lot of different ways. So
Right, so Wendy, when I'm hearing you say, would it be helpful to rephrase that gatekeeper to it's more about potentially concerned about denying referrals or lack of access to being for patients to get the services they need? Okay, we'll come back and do a quick check on that. Howard, I'll have you go, and then I just want to open it up for any of the members who have not had an opportunity to share, and then we'll move on. So go ahead, Howard.
I just want to briefly just clarify that we're not telling anybody what to do. We're making a recommendation. Is that clear? I mean, if we make a recommendation about the primate lab, we're not telling them to close it. We're just giving them a condition we may be recommending. Is that?
Yeah, I was going to allow a little bit more conversation about that when we move forward to making the recommendation. So I will respond to that. But again, I'm going to open it up to my Oregon Health Authority colleagues on that. My understanding, if when we will look at the decision-making process in a moment, but if you agree to approve the transaction, you can suggest conditions. And conditions can be concepts. They can be like, a condition may be, to address the primate center. And so that is something that the Community Review Board can make if you propose to approve with conditions. Zachary, did you want to make any other comment based on what I said?
I think you got it.
Okay, great. Okay, Joanna, please. And then I don't know if Jerry, I'm just looking at Jerry or Joe, if you had any comment that you wanted to share. I just want to make sure that you had an opportunity to do so.
This is Joe. I don't have anything additional. I share a lot of the same
Okay,
concerns and issues, and I think we're on the right track here.
okay. And Jerry?
I think both sides summed up things pretty succinctly for me.
Okay,
Thanks.
great. Just want to make sure that you had an opportunity. All right, Joanna, then after Joanna, we'll move on.
Yes, I just wanted to, I think most of the concerns are there. Some of them I think OHA will be able to address because I think they know more than we do about some of these pieces. So where we say we don't know about this, they may actually know more about it. I am pretty concerned about the animal care facility because we haven't asked, it wasn't included in any information from OHSU. So we have only heard from one side. And I'm not saying I'm in support of the research center or against it. I just feel like, yes, the public is obviously concerned about it, but if it's something we're going to make any comments about, I don't feel very comfortable about it because we have not heard from the OHSU side at all.
Thank you.
I don't know if they've been asked to say anything, but there's been nothing from them.
Thank you. Okay, I just want to go back to the gatekeeper one since there was a lot of discussion and potentially different interpretations. Wendy, who I think kind of, as she said, was the originator of this concern, she offered a proposed change, something more aligned. We're more concerned about the transaction resulting in more denial of referrals or lack of access for accepting patients. Is anybody concerned with that if we modified that? Okay. Thank you. Wow, great feedback. And so we will revise the concerns and the opportunities as you shared here. I'm now going to move us on to the next slide. And this is just a reminder, last week, the Community Review Board also discussed specific opportunities and concerns about 2 of the criteria from the Healthcare Market Oversight Recommendation Framework: costs and access to care in medically served areas. So this criterion here, the transaction will benefit the public good by reducing the growth in patient costs or maintaining sustainable cost growth. Here are the concerns or the opportunities that we heard. That Oregon Health Sciences University themselves had stated costs would go up. Research and analysis has shown that these types of transactions raise costs. OHSU-Legacy have stated they want to keep costs down. Economic and political environment makes predictions difficult. There is simply not enough data to determine whether costs will go up or down. And need to think about what happens to legacy if the Community Review Board disapproves and eventually Oregon Health Authority. Do costs go up? Do services stop? So those were the key observations, concerns, opportunities that we heard that you shared about this criterion. So again, curious, how well did we capture your observations, and was there anything else that we needed to include? And we'll do the same process. Yes, Teresa, thank you for kicking us off.
I'd just like to note that I think it's important to point out the distinction between costs and prices. OHSU says that costs would go up. Well, costs are generally understood to be what they pay to provide services, like the cost of salaries and drugs, for example. So they're actually, I think, telling us that prices, what they charge patients and insurers, will go up. Because costs can or maybe not don't always have to be passed on to the consumer. So if they increase costs, if costs increase, there are ways to mitigate how much of that gets passed on to consumers. But right now, they're just saying prices will go up.
Okay, thank you, Teresa. So I'm hearing you is really kind of there's a distinction between costs and prices, and be clear about that distinction. And if costs go, if prices of goods and services go up, there are different ways to mitigate whether that goes to the increased cost to patient. Thank you. Joe?
So I've been struggling a little bit with how to articulate this, but it's the last bullet point, and it's kind of come up in a lot of our different lists, it seems. And that's, all of this is really dependent on what would happen if it was not approved and what trajectory Legacy took from that point on. Because if they were able to right their economic ship and turn back into a health system that provides a good alternative to the other systems in Portland, I mean, I think we would all agree that it would be good to have, separate and more health systems that were working together and competing to keep costs down and quality up and all of those things. So in some way, I think we need to sort of either find a way to articulate, what do we think will happen if Legacy, with Legacy, if we don't approve this, and if they do get bought out by private equity or, a less than desirable purchaser, and they consolidate or cut back or decrease access or pull back their commitments to equity, I think that's the worst of all cases, unless they completely go bankrupt and then close down altogether. I mean, that's kind of the nuclear option, I guess. So I think our deliberations kind of all depend on what our assumptions are for what happens to Legacy and the market in Portland if we don't approve this. Which is, I don't know if that even said that correctly, but that's kind of where my thinking is going on that.
Yeah. So Joe, what I'm hearing you say is that, in an ideal world, we would prefer to have more entities out there, and that if Legacy was able to, figure out how to move forward, that would be great. But what I'm hearing you say is it would be helpful if we had a better sense of what would happen if this transaction is not approved and Legacy is unable, right, to regain its footing. What would be the consequences in terms of another third party equity purchasing it out? How might the impact be in the marketplace? And we're just unsure of that.
Yeah.
Thank you, Joe. All right, Joanna?
So I think, they may not have said a whole lot, but the fact that Legacy is willing to be acquired because that's the only way they can move forward, I think immediately tells us that there's going to be negative consequences if it doesn't go forward. Otherwise, they would be, be a hostile takeover, and they'd be saying, no, we can do just fine on our own. Obviously, they can't. There's also been some cost cutting that has been done. There are some things they've said that have been either closed down or reduced services. So I think there has been some information about the consequences of not moving this forward. So just from what I've seen and in comments, that would be my thinking. But I agree, it would be good to have more information. But I do think that we know that it's for Legacy, this is pretty dire, or they wouldn't have approved it would be acquired. They would have done a partnership, not an acquisition.
Okay. All right. I am looking at the time of the agenda. I know we had a lot of rich conversation on the opportunities and concerns, which is sometimes related to these criterion. I don't see any more hands up, so I'm going to suggest that we move to the next criterion to make sure that we have enough time to talk about the other three. So this criterion is the transaction will benefit the public good by increasing access to services in medically underserved areas. What we heard from you is that OHSU's intentions are to increase services, but there were concerns about their plans, the real specifics about how these intentions will be put into place. There was concerns, they're just not sure about the entity's current plan leads to increased services in medically underserved geographic areas specifically. There just wasn't a lot of details given on that. We heard that the transaction would make it easier to train students and residents. However, training can occur without the affiliation or the merger. And again, this is similar to what we just talked about, that, there's a concern saying no to the transaction may decrease services. Legacy may shut down its services, exactly what we were just speaking about. And it's just also unclear about what the new foundation's role could be in helping to increase access. So again, I'm curious to see how well did we capture your observations, what else needs to be included. Okay, I'm going to move us along to the next slide, please. I'm going to give us a brief framework, and then we're just going to take a couple minute stretch break, and then we'll come back. So now we're going to discuss the remaining 3 criteria for the healthcare market oversight recommendation framework. Next slide, please. Again, we have seen the slide several times. These are the overall criteria that Oregon Health Authority is using to make its final decision. The ones that are bolded are the 5 that Oregon Health Authority is asking the Community Review Board to consider. Just a note, we just talked about the first 2 bullets under number B, and now we're going to focus on the 3rd bullet under number B, and the one under C and the one under A. Okay. So what I'd like to do, it's 12:17. I'm going to shorten the break to 3 minutes. So I'm going to just ask folks to come back at 12:20. And if you can move to just the 5-minute break slide. So come back at 12:20, and we are going to hear your observations to those next 3 criteria. Thank you. Okay, I know that was a very, very short break, but I again want to make sure that we have enough time to hear your perspectives on the next three criteria. Some committee members may be coming back. And so I see that we have Joe and Teresa here. And if you can, Wendy, I think Leslie, thank you. And if Wendy or Joanna, if you want to just put up your hand, let us know you're here. Great, thank you. Okay, we'll move forward. Okay, next slide, please. All right, so this criterion that we are going to discuss is the transaction will improve health outcomes for residents of the state. So we're going to do very similar what we did last time. We want to hear your perspective about how well the proposed transaction may meet this criterion, and specifically why or why not. And I'm hoping that we can hear from all community review board members. So if everybody could just share one round first, that would be great. And maybe someone who hasn't had an opportunity to speak as much would be willing to go first, if you would feel comfortable doing that. Joe, thank you.
Sure. I think that to the extent that some of the goals of the transaction, such as improving wait times for tertiary and specialty care, quaternary care, reducing the or increasing the access to primary care, could have the potential to improve health outcomes for residents of the state. So if they do meet the goals that have been stated, that does have the potential, I think, to improve health outcomes.
Thank you, Joe. So I heard you say that there is a possibility that improving wait times for tertiary care and increasing access to primary care, if those goals are met, that would help improve health. Thank you. Anything else?
Right. Thank you. No, that's all I've got. Thanks.
Thanks, Joe. Okay, who else would like to share? Thank you, Teresa. Oh, Teresa, you're on mute.
There we go.
Thank you.
Sorry. I just want to speak to the cancer service line claims that OHSU makes. They're saying that they have to double their cancer services in the next 10 years to serve our community. But those projections do not mesh with cancer case projections from the National Cancer Institute or with population growth expectations for Portland. That concerns me. OHSU has increased their cancer services, but only by 18% in the past 10 years. And that tells me that there's no way they could need 100% increase in the next 10 years. I find that a little bit hard to believe. So in other words, how does this relate to what I'm saying here? Well, I'm not really sure that their claims about the need for this transaction based on numbers of patients are entirely trustworthy.
Thank you, Teresa. So just kind of concerned about the numbers and the projections that OHSU is sharing specifically around cancer services are just not in line in what you understand to be other benchmarks and or what they've done in the past. Thank you. Jerry, please.
Yeah, thanks. The definition of improved health outcomes is kind of vague. I know that they presented some statistics on certain criteria like immunizations or breast cancer screening and whatnot. And some of those criteria, they haven't been meeting their goals. So that's a concern. And also, is is OHSU or Legacy even sort of the venue where we should be working on improving health outcomes? If you're dealing with acute, or serious conditions, the health outcomes are one thing, but what about all the preventative public kind of health measures that we can implement that really don't require sort of like a medical clinic intervention type of thing? So I think again, it kind of misses the mark on their proposal, but um, I didn't see any plans to like go out and do the great improved health comes for the residents of, say, the metro area. So
Thank you, Jerry. So what I'm hearing, you're just, again, the evidence that you're seeing from the entities on how health comes will be improved is not as detailed as you would like. And you're also just really curious about more of that primary care preventative approach and how that could improve health. And again, just not seeing that evidence. Got it? Thank you. Leslie?
I think for me, it's kind of similar. It's like unknown. If I had to answer the question, I think the intent is there to get the right care at the right time at the right place by both entities. One of the things that does concern me is in an earlier meeting, they stated they were transitioning to value-based care. And I think if they could commit and show more details about what that means for them around access, cost, preventative care, and outcomes. I felt like they mentioned value-based care, but didn't dig into it. And they were talking about it as a transition, something they're currently not doing, but then again, plan to start in the future with many unknowns and how they're going to do it.
Okay, thanks, Leslie. So I'm hearing you say that you believe the intent is there to get the right care at the right place in the right time. And again, you're just concerned about the details and the ability to do this. And the example you gave is there's an intention to transitioning to value-based care. But again, there wasn't a lot of details of how that would happen. Thank you, Leslie. Howard?
Yeah, I just want to point out, I think it's being said, or at least implied, that health outcomes is broader than just clinical medical outcomes. Really includes, I think, these days, things like food insecurity, paying the rent. And I think the foundation aspect of this, if we include that as part of the transaction, is one opportunity, I think, to address those other health outcomes that are important. If you look at health outcomes, really the clinical outcomes are a relatively small piece of it compared to the other aspects of care, of health that also matter in terms of health of the community.
So, Howard, what I'm hearing is a little bit what Joe was sharing in terms of we know that health outcomes is dependent on many factors, and clinical care can be a smaller piece. And you were acknowledging, food insecurity, being able to pay rent, and some people call that social determinants of health. And you would like to see how is this transaction really going to support that kind of broader aspects of health? Thanks, Howard. Okay, I'm curious about Joanna or Wendy.
So I kind of agree with what has been said. I think from the narrow perspective of clinical health outcomes, the increased, I don't say efficiency, the way they're going to plan to deal with tertiary care provides some indication that for people with more serious conditions, perhaps health outcomes will be improved. I know there's also the piece about the emergency room and the problems with having people lined up all over the place because there's no beds. That should improve. But in terms of the broader health outcomes, I don't know that we have clarity.
Okay, thanks, Joanna. So what I'm hearing you say is that you're agreeing, you know, with more just the narrow aspects of clinical health and not the broader sense. You just don't know if they have the ability to do that. But I also heard you say that, you know, having more tertiary services will help with outcomes, and helping to alleviate, you know, the backup in ED would also help with outcomes as well. Thank you. Okay, Joe or Wendy, please.
Yeah, so I think that in my mind, it's pretty hard to have confidence that either system, separate or combined, will really be able to keep up with the growing population and the trends towards the higher need. So the way it's phrased is a little tough for that. However, if we do break it down to some of what we've talked about previously, if OHSU and Legacy combined can truly open up the additional hospital beds that Deb indicated, and some of the other items that have been addressed around that, then yes, I think that it does help. I'm still unclear what happens if this doesn't go through. Is there another means for those to be opened up?
Right. So what I'm hearing you say is, you know, you do think with the transaction, if we can open up the additional beds and the other access to care and quality issues, that you think it will be helpful, but knowing that it's hard for either system to keep up with the great need that's out there.
Yeah, those are really big ifs. And I
you're
think
still
we
just
expressed
unsure
in
about
prior slides that we have doubt they can really be done. But
and of course, just what will shift if the proposal doesn't go through with Legacy. Okay. And Joe, I know you already did share, you kicked us off. So I think everyone's had an opportunity to share. So I'm going to move us on to the next criterion, please. And this criterion is rectifying historical and contemporary factors contributing to a lack of health equity or access to services. So again, we are interested in how well may the proposed transaction meet this criterion, or why not. So thank you for someone getting us started. Wendy, thank you.
yeah. So I think this is another one of those that if they, I think that there are really great intentions here. I don't know that we've really seen practical plans that fit within a manageable cost structure that fit with the whole picture. So again, I think the intention is there. I think there's a desire to do this. Best case scenario, it would be able to be done, but it will come at a cost. And how does that get balanced out with everything else when it really comes down to writing checks?
All right, so what I'm hearing you say is that, yeah, the best intentions, but to do this, it will come at a cost. And what will be the trade-offs? How will they balance it out financially? You're unsure. Okay. Who else would like to share? Yes, thank you, Teresa.
I think it's hard to answer this because so much depends upon whether or not they're able to achieve their goals of hiring more primary care providers, more nurses to staff the ICU, more people to practice in the operating rooms. And we don't know the answer to that yet. It's really, I feel like it's so up in the air, it's very hard to project. So all I can go on is what the literature says. And the literature has generally said that it either stays about the same or even gets worse. Access does. So I'm not confident that they will be able to rectify historical factors that contribute to lack of health equity.
Okay, Teresa, so I just hear you saying it's just so dependent upon being able to meet their workforce, right? Targets, and being able to hire the qualified folks who can do the work that needs to be done. And so the literature, you're just reminding us, the literature says things stay about the same or they get the worse, but it's very hard to answer this. Thank you. Leslie?
I agree with that. I think, when you look at the criterion, they're going to rectify these historical and contemporary factors. I'm not sure that the public is always aware of that. We have new people moving into Oregon, and is this really going to move the needle? I felt like for me, the answers around health equity and access to care in the community, listening sessions they didn't have a lot of substance. There was a box that was checked, but it didn't go really deep to actually address, when you look to address this criterion. So for me, I feel like it's probably more of a no, that it's not meeting this criteria versus an unknown.
All right, thanks, Leslie. Said you're leaning more, it's more of a no, but it's still very hard to know and just unsure because of the past issues and a little bit concerned about the community listening sessions they did. And there just wasn't a lot of substance around this. Thank you. Joe, please.
So I agree that I don't think there's any rectifying past wrongs that have occurred. So I think they can move in a better direction if they meet the goals of the transaction, and the foundation is able to integrate and take the community's input and have that as one of their primary goals of their existence. So correcting, there's no correcting. So I don't know if I agree with the word rectify. I think they can move in a better direction, and I would like to see them continue to move in that direction, and probably with more vigor than they have in the past. And I think there's some very strong national winds blowing in the other direction right now, which is also very concerning.
Yeah, so thank you, Joe. I'm hearing you're just unsure, you don't think that there can be rectifying of past wrongs, and hoping that they could move more in this direction if the goals are met. You're also concerned just about the national strong headwinds that perhaps are not supporting this direction. Thank you. All right, Howard, please.
Yeah, I agree with everything's been said. I think that the foundation is the opportunity really that at least is pretty clearly specified in this. I have issues. I think there are issues have been raised about the foundation itself. Nobody's really talked about the fact that the foundation is going to still have a 50% share in the partnership with the insurance, and perhaps has some financial risk in that relationship going forward. If they have to sell their 50% shares, I think within a certain period of time. At least that's their plan, which may be difficult to do. And the other thing I was going to say is I would have to go back myself and look at the metrics around this criterion to see what they have in the metrics around what in terms of their goals for this particular criterion. I don't remember them specifically, but perhaps other people do.
All right, thanks, Howard. Again, sounds like you're concurring with what you heard others said and really saying the foundation is the big opportunity here, but there's a lot of unknowns, especially with the 50% of their dollars invested in insurers with, I think, Pacific Source, and just unsure what that financial outlook would be, and unsure about what goals, what metrics may be related to this criterion. Okay, Joanna or Jerry, love to hear from you.
I don't really have a whole lot to add. I've only been in Oregon for 6 years, so I don't have a long historical perspective on this. I think the foundation, what seems to me, the foundation is probably the angle that is going to be focusing on this. I think we need to, there needs to be sort of clarity. And again, Howard, I agree, we need to look back at the metrics. What specifically are we talking about rectifying, more than historical and contemporary factors? What are those factors? What are we actually? It's sort of a very generic thing. I'm not sure exactly what's being referred to, and so therefore can't really look at how to address it or whether they are planning to address it specifically.
Okay, Joanne, I'm hearing you're kind of concurring with what you're hearing others have done, and agree about the foundation as a potential opportunity. But again, there's just some unknowns around what metrics may there be and what are those factors that would need to be rectified to move forward or to address historically. Thank you. Okay, Jerry, please.
Yeah, as far as I've only been around here in Oregon for 18 years, so I don't have that historical perspective, but I am on the board for the Clackamas County Community Health Centers, and I've worked in other community health centers. And those places do reach out to those communities that have lacked the equity and access to services. And so I don't see OHSU saying we're going to maybe create some partnership with community health centers that are doing some of the work we haven't done. So I don't see that activity taking place. So there's an opportunity there. Again, it was missed. It wasn't dealt with. It wasn't really addressed firmly. And there may be this money in this foundation, but as my experience with foundations, just because they have $600 million doesn't mean they're going to spend $600 million. They may spend $6 million or 60, because they want to continue that foundation and keep investing their dollars. So, yeah, this question was kind of like at the end of the exams, like, oh, hurry up, we got to answer this question and get our proposal submitted on time. So, yeah, it's a bit weak.
Okay, Jerry, so I'm hearing you say, you have concerns about how the transaction will meet this. There's not as much, again, details on how they would do it. You gave some examples of, like, one example could have been reaching out, right, to community clinics, federally qualified health centers who really can connect with perhaps people who have been disadvantaged by inequity. And so you're just not seeing those plans.
Yep.
Okay, I believe everybody who's here has had an opportunity to share, so I'm going to move on to the next criterion, please, the next slide. And this criterion is that, I just have to get to the full, that there is no substantial likelihood that the transaction would otherwise be hazardous or prejudicial to consumers or the public. Zachary, would you mind just taking a moment to just give a little bit of background of what this means and how the Community Review Board may think about discussing this?
Sure, yeah, happy to. So this language actually is borrowed from insurance regulation as well. And as a reminder, the healthcare market oversight reviews transactions that involve insurance carriers. So this is kind of borrowed from what's called NAIC, National Association of Insurance Commissioners. And the idea here is that, the term hazardous or prejudicial, it particularly in these regulations, generally relates to kind of actions that could harm the public or policyholders being someone who's a member of that health insurance carrier. So this could include kind of adverse financial findings regarding, again, a financial insurance entity, or kind of cash flow issues. For example, if an insurance company goes bankrupt, that could be harmful. Any kind of operating losses, poorly managed risk could be another example, or any kind of biased decision making that the entities could do that would affect consumers. So those are kind of the types of things that are conveyed with the term hazardous or prejudicial. It is a wonky term, so I'll acknowledge this isn't everyday language, but this is what's codified in the regulation.
Thank you, Zachary. So I'm hoping that gives enough background to share your perspectives about how well the proposed transaction may meet this criterion. And again, the full criterion reads that there is no substantial likelihood that the transaction would otherwise be hazardous or prejudicial to consumers. So who would like to get us started here? Thank you, Teresa.
My thought is that we've already covered all of the ways in which it might be hazardous or prejudicial to consumers or the public, in terms of the cost potentially going up, access not being improved, not engaging sufficiently with the community of people who are underserved and have been harmed in the past. I think that's enough, and I can't think of other ways in which it might be hazardous or prejudicial.
Okay, thanks, Teresa. So you feel like you've already covered those other cost, access, health equity issues that would really build up to this criterion here. Thank you. Wendy.
Yeah, I don't see in my notes, and I'm sorry if I missed it in the materials. There's a lot of stuff there. I also don't think that we've talked about it here. If any current insurance contracts would not be carried over from Legacy to OHSU, or if they would be impacted, that could, of course, have a significant impact. I assume not, but I don't know if that assumption is accurate.
Okay, so Wendy, what I'm hearing you say that if any current insurance contract was not carried over, you could see that it could have impact harm, but you're just not sure. You haven't had any information to lead you one way or the other. Thank you. Joe, thank you.
Just going back to that, insurance contracts being carried over. United Healthcare and OHSU apparently are no longer in network, I guess, or OHSU is no longer in network for United Healthcare. And I guess I'm not sure what the impact of the merger would be on United Healthcare. If I think they're going to continue to contract separately with Legacy until sometime in the future, I guess, after the transaction occurred, if it does. So I'm not sure it would be prejudicial if they were able to kind of rectify that lack of coverage or lack of in-network coverage for United Healthcare. But yeah, it would be hard to know, I guess, whether or not Legacy would have had the same kind of outcome with United Healthcare if they move forward independently. So I guess I don't really know how to judge this one.
Okay. Yeah, so I'm hearing it's just unsure how best to judge it. You are concerned about right now OHSU does not have a network with United Healthcare. How would that look in the future if Legacy would continue? Well, how would that would look like with the
right? Because I think if the transaction ended up meaning that Legacy no longer was in network with United Healthcare, that seems to me that it would be hazardous or prejudicial to consumers.
Okay, great. Teresa, were you going to shed light on this comment? If not, okay, perfect. Because then I would just open up to everyone else. Thank you.
I just wanted to mention that in the last few days, OHSU and United Healthcare have reached what they're calling a good faith agreement, and they're still working on the details, but it looks like there might be hope that they will continue to be in United Health's in-network providers. Maybe, hopefully.
Okay, thank you, Teresa, for sharing that information that you've learned. Very helpful. Okay, who else would like to share their perspective around this criterion? Thank you, Joanna.
So I agree. I think it's difficult for us to come to other than things we've covered elsewhere. The insurance piece, I guess my caution is, and like you say, last minute, they're going to make a deal. What I have heard from other hospital systems is that it's very common that the insurance companies kind of hold you hostage till right at the end. We had it happen in another state, and It came down to the wire. We got information from the insurance company to say they weren't going to cover it anymore. We had to call. We were supposed to raise hell and all this stuff. 3 days before the expiration, miraculously, the contract got renewed. And what I have been told is that this is a tactic that they're using more and more. So I'm hesitant to say, oh, this is going to be bad, because I don't think we have any idea of what's going to happen in terms of insurance coverage when they combine, or whether anything different will happen at all.
All right, thank you, Joanna. You're sharing, past observations that it's just really hard to know. We don't really know what will happen with insurance coverage when combined because of these tactics that you've seen before. Thank you. Okay, Howard or Jerry or Leslie? Thank you, Howard.
I raised my hand. To me, somehow I keep coming back to the primate lab, but I think that related to the reputation of OHSU is something that somewhere needs to fit into at least the way I'm thinking about a recommendation with conditions. I would just point out that I watched the NCAA games over the weekend, maybe for 10 minutes. And in that 10 minutes, there was an anti-OHSU primate lab commercial that actually showed. So somebody's spending money. I think it's one of the groups that actually submitted public comments. And the other thing I would just say is, OHSU can see these comments as well as we can, and they haven't responded to them. And I think that says something also. They've been silent. They could have a response that they could put in as a public comment, and they haven't done it. And to me, that speaks loudly to the way they're thinking about how this might be addressed or not addressed in this process.
So thank you, Howard. What I'm hearing you say, the primate research lab perhaps is something that fits under this bucket, and it seems to be a pretty big issue specifically related to OHSU's reputation, and you're just surprised that OHSU has not responded to it, given that there's been so much publicity around it. Thank you. Jerry?
I think the issue with the primate lab the legislature should pass a law. If they want to shut it down. So we don't have to deal with it here, because it's really not a whole lot we can do. But there were good basketball games, Howard. Presidential or hazardous, I don't really have enough information to really say one way or the other. So maybe they wanted to give us some more information, or at least address that criteria in the law and the statutes and the rules to help us as CRB reviewers understand how they would address this issue if it doesn't take place. Mostly the response was, once you approve of this acquisition, we'll start doing all these great things. So I'm not getting a really good feeling about the hazardous potential to consumers could be, because everyone's all worried about private equity firms, is if someone comes in and buys out Legacy and then they start doing their cost cutting or whatever creative financing things that they like to do. So, but that's all I have to say.
Yeah, so Jerry, what I'm hearing you say is just, you really can't say one way or another. You don't really know the exact intent that's in the statute, and other than the things that we already discussed.
Yes.
Thank you. Okay, Leslie, can you please share your perspective?
I'm in agreement with what's been said. I think I looked at it kind of from the could it be harmful or unfair to consumers? And I'll just add, does it create a healthcare monopoly and limit choice for patients? But agree with what's been shared.
Okay, so I'm hearing you're in agreement what you've heard others say, and one thing could be looked at it could be harmful and unfair if it creates a healthcare monopoly and limits choice. That's one interpretation that you're seeing. Thank you. Joe, please.
Yeah, I just wanted to kind of correct the fact that the OHSU did respond to the ad campaign at least, and on March 7th they published a statement on that ad campaign. I don't know if they put that in our public comments, but it's out there, and so they have responded.
Thank you. This is what I love about this group. We're educating each other, helping us to piece together all the facts that we may not have. So thank you for sharing that, Joe. Yes, Joanna?
If there's something out there, it would be really helpful. I have not seen it. I'm not a Portland resident, so I don't see all the media that you all do. So I have not seen anything. And for me, that's, if we're even thinking about saying anything about it, I really want to hear something from OHSU before I would say anything. So if there's something, if it can be posted, or if there's some way that I can get that information, that would be great.
Great, thank you, Joanna. And I'm just going to direct a question to Zachary, my Oregon Health Authority colleagues. So I've heard the Community Review Board members ask in different ways that they think this is an important issue, yet they don't know what their role is, and they don't feel like they have enough background information. So and I've heard even a request for OHSU to share more information. So is there a way that we can accommodate this request, Zachary?
Yeah, happy to talk about this. So yeah, we're happy to send any link of any document that will be helpful. We don't have a public comment per se from OHSU about this, but if there's a press release, we can send that around.
Can we ask for one? There's a question. Can't we ask for one?
Sure. Yeah, I mean, I think there's probably a couple different routes to do this. The most expedient is essentially to have that press release kind of in the CRB public record, as it will. I think that'd be most easy. Technically, you could do a request for information. There's a whole lot of steps related to that, but I think it would end up in the same place of here's the statement from OHSU, so you'd have that information.
And I see that there's been some links put into, I think, some of the ad campaign right now. So, but I heard, Zachary, you could also see to make sure that we have from OHSU's whatever their public response has been made to send that. Okay. Leslie, did you have a comment?
I just want to point out, and thank you, Joe, for referencing the public comment. It looks like there have been several public comments uploaded on the website since our last meeting, and there are a couple that speak to the previous criterion about historical harm and wrongdoing. So I just would encourage all of the community review member boards to go in and look. That I hadn't had a chance to do that this morning, so I'll be looking at those as well. But at first glance, there's quite a few who've been added.
Again, thank you for educating each other, sharing resources, directing us to where to look. There's a lot of information here and a lot of questions. Okay, I see we have about 2 minutes left. Can we go back to, let me see the slide. The next slide, I think we'll go quickly. I'm going to recap the next steps. And so we've seen this slide several times, but this is just a reminder. When we come back on March 31st, next week, this is what we're going to be doing. We are going to be reviewing the feedback that we heard from you around the 3 remaining criteria, as well as updating the feedback that we shared today. So you will have all of that to reflect on. And we will spend most of our meeting going through those 5 criteria and trying to get a sense of, oh, do we think it meets it or not, with kind of thumbs up, thumbs down. And then if we are able to feel comfortable, we will start moving to making the recommendation for approve with conditions, or disapprove. And I do want to underscore, we've talked several times that this opportunity for conditions. So I want you to be thinking about that in terms of, if the committee decides to approve with conditions, be thinking about what might be some of those conditions. And again, we don't have to be the lawyers. We don't have to wordsmith it. We just need to come up with the concepts, and then Oregon Health Authority can kind of shape the language on that. So I just want to give you a heads up. The next meeting is a big meeting because this is where we will really start in the decision-making process. And if we're able to come up with a final decision during March 31st, that would be the ideal. Yes, Howard?
I just want to clarify again about this foundation piece of this.
Mm-hmm.
Because in the application, it says that both transactions have to be approved, or this one, the one that we've been created to look at won't be acceptable to at least OHSU and Legacy. And so are we being asked to make recommendations about both transactions or just one?
Yeah, I can jump in here. Thanks, Howard. That's a great question. So this community review board, you all are being asked to weigh in on the OHSU Legacy proposed transaction. The transaction involving the creation of an independent foundation, Pacific Source, and Legacy, that's actually another transaction. It's also being reviewed. There are other opportunities for public engagement on that other transaction, both Legacy Foundation, and Pacific Source. There's two regulatory processes. One is called OHA Form A review. It's a wonky phrase, but that's what it's called. And then there's Department of Consumer Businesses Form A review. There's going to be public hearings and listening sessions associated with that review. So all that to say, your specific charge is really focusing on the OHSU Legacy piece of it, and the foundation is a different track.
Thank you, Zachary. And so you have to keep that in mind, right? As you're thinking about the foundation, that you are not responsible, right? For making ultimate decision upon that. That's, as Zachary reminded us, a second transaction. Makes it a little bit more.
That's true, but we would still be able to make a recommendation, even though we're not responsible for that particular one?
Yes, you can include, in your recommendation is your recommendation. There are no specific guardrails that I'm going to put on it or that OHA will put on it. Yeah, so we welcome your thoughts.
I recognize we're about 2 minutes over, but we're just going to wrap this up in about a minute. So thank you for people being able to stay on if you're able to. Let's move to the next slide, please. I'm going to move on because we'll talk about this tomorrow, but I mean next time, but we know that consensus is our goal is for everybody to be in agreement. And if we are unable to do that, we'll do majority vote, but our goal is consensus, and we'll talk more about that next Monday. Next slide, please. So I've already kind of shared, we're meeting on March 31st from 11 a.m. to 1 p.m. And that's where we'll review what we heard today, and we will start moving towards making a recommendation to Oregon Health Authority. Next slide, please. This is just a reminder, these are where the Zoom link is available, and here's all the ways to communicate about this. Next slide, please. And again, just a big thank you. I really thank you from the bottom of my heart to the community review board members. You can tell you're doing your homework, you're doing the reading, you're sharing and teaching each other about where to find information. You gave really thoughtful responses about what your perspective is around these criteria. So thank you very much. And I very much look forward to Monday and start really rolling up our sleeves and see where we might land around a potential recommendation. Until then, best wishes for the rest of your day.